Everyone to today's webinar. We're just going to give it a moment for the rest of the attendees to load in. If anyone wants to say hello in the chat and say where you're joining us from, we'd love to hear from you. Good afternoon. On behalf of the team at the Ceres Institute for Children and Youth at Boston University Wheelock College of Education and Human Development, it is a privilege to welcome you to today's discussion, How are the Teens and Tweens? This discussion is part of a wonderful program that we have here at BU Wheelock, the Equity and Social Justice webinar series. I'm Marissa Cole. I'm the Managing Director for the Ceres Institute for Children and Youth. The Ceres Institute is dedicated to community-engaged research and evaluation that centers the voices and experiences of youth, families, and communities. Working with key partners and communities, we use rigorous, systematic, and innovative methodologies to develop knowledge that policymakers and practitioners can use to support children, families, and their communities. Today's conversation focuses on a topic that resonates with so many of us as researchers, practitioners, policymakers, and parents. Headline after headline speak to the harmful effects of the pandemic on teen mental health. Teens have experienced the stress, anxiety, fear, grief, isolation, and loss of connection with so many in their lives. As the pandemic shows no signs of letting up, how can we take what we've learned from the early stages and use that knowledge to support our teens and tweens going forward? It is clear we need to redouble our efforts to support our most vulnerable teens, and today's presentation will discuss some of our current research and practical approaches to supporting them. Our agenda today features a brief presentation of research from Jen Green, an associate professor here at BU Wheelock College and a Ceres Institute faculty fellow, and Keisha Perkins, a clinical research assistant at Bradley Hospital, who served as a lead author and a research assistant while she was a senior here at BU on the study that she will be presenting today. Following the research presentation, we will hear from two respondents, Ellie Castine Richards of the Cambridge Health Alliance, a BU Wheelock alum, and Stephanie Malia Kraus of First Quarter Strategies, who is also a fellow with Ceres Institute. Our event will conclude with questions and answers from you, our audience. If you have questions for our panelists or presenters, please use the Q&A icon on the bottom of your screen. And closed captioning is also available for this webinar. Please use the CC icon at the bottom of your screen to turn captions on or off. We will be emailing out a link to the recording following this webinar, and it'll also be posted on the Ceres Institute website. Without further ado, I'm pleased to turn it over to Professor Jen Green. Welcome, Professor.
Thank you, Marissa, and thank you for inviting us here today to talk about how the teens and tweens are doing and to share research that was led by Keisha Perkins and a number of other BU undergraduate students and a high school student who were engaged together in this work and this research that we'll be speaking about today. So the kind of big picture of what we know so far about how teens are doing during the pandemic is not especially well. There was a very large meta-analysis that was recently published that found that globally, depression and anxiety are up 20 to 25% among children and adolescents. And this finding aligns with research that's come out of the Centers for Disease Control that has found that mental health related visits to the emergency department have also increased, and particularly increased in the months during remote learning and right after things shut down due to COVID-19. We also have a number of studies that have shown that remote learning and hybrid learning are associated with increased mental health challenges, particularly for older youth and for low-income youth. And we know that youth who were able to be in person this past year seem to be doing better generally in terms of their mental health. However, as I note in that bottom bullet point, there's some anecdotal stories and articles that have come out that have identified some children and adolescents who really did thrive during remote learning and who are struggling now with the return to school and more in-person learning. The research we'll be talking about today is focused on school connectedness during COVID-19. And school connectedness is defined as the extent to which students feel personally accepted, respected, included, and supported by others in their school social environment. And that's a quote from Carol Goodenow. And research has shown that school connectedness across the board and generally is a powerful predictor of positive mental health, that youth who feel more connected to school seem to be doing better across a wide range of experiences in their life, including with their mental health. And there have also been some studies that have shown that school connectedness might be even more strongly related with mental health and school outcomes than social connectedness, which is connectedness to peers and having strong friendships. So that feeling of feeling connected to school, accepted by school, and included in school is a really important feeling for children and adolescents. And so our research here was looking at the question of whether this was still true during remote learning due to COVID-19, and how students' feelings about school and their experiences with school may have changed during remote learning. So I'm going to turn it over to Keisha now. Oh, I'm sorry, I actually have one more slide that I'm going to talk about first. So we started this study. The study came out of some work that we were doing in partnership with Medway Public Schools. Our research team was contracted by Medway Public Schools to develop an online module on stress during COVID-19. And so we developed an online tool that they could use with their students during the time when schools were shut down in spring of 2020. And this online module included 4 major components that you can see here. First, definitions of stress and anxiety. Second, key tips for reducing stress, practicing relaxation, making time for pleasant activities. And we made sure that those were pleasant activities that could be done remotely. Strategies for establishing routine, like creating a schedule and a sleep schedule, which we know is really challenging for a lot of children and adolescents during remote learning, and when and how to ask for help. So we made this module available to Medway Public Schools, and then a number of other school districts reached out to us who were also interested in using the module. And one of those school districts agreed to partner with us for the research study that Keisha will be presenting about today. And we collected some data along with the module as students were completing the module. And I think that Marissa is going to put a link in the chat to the module, which is still available. And we have some new modules that will be posted in the next month on stress and anxiety, depression and suicide, and substance use that can be opportunities for students to learn remotely about these mental health related topics. And now I will turn it over to Keisha.
Thanks, Jen. So our study assessed 3 constructs. First, we assessed adolescent mental health, the generalized anxiety disorder scale, and the patient health questionnaire, or brief 2-item measures, assessing anxiety and depression symptoms, respectively. The second measure was a school connectedness scale that included items such as I feel close to people at the school, I feel like I am part of the school, and I'm happy to be at the school. And then the last measure assessed social connectedness with items such as I feel like I have lots of friends. We modified 2 questions for the COVID-19 context, such as I get invited to do things with other people online. So for example, group chats and gaming. And then, so our study has a total of 320 participants. They represented 1 Massachusetts school district of 2,274 students. 837 participants completed the online stress and COVID-19 module. And of those, about 38% of those students completed the post-module survey. Of the 320 students, 60% identified as female, 39% as male, and 1% indicated they used another identity. High school students represented 62.8% of the sample, and the remaining 37% were middle school students. Because 90% of students in the school district identified as non-Latino white, we didn't ask the participants their race or ethnicity, so their responses wouldn't be identifiable. And then in terms of the results, which are really exciting, so about 22.8% and 19.4% of students screened positive for anxiety and depressive symptoms. Female students reported significantly higher rates of anxiety and depressive symptoms, and high school students reported higher rates of anxiety. Average rating of school connectedness was 3.85. This was on a scale of 1 to 5, with male and middle school students reporting higher rates of school connectedness. And then we have some graphs. So this graph shows the percent of students who had elevated depression scores. The red line represents low social connection and the blue line represents high social connection. Students with higher, students with higher school connectedness were less likely to have elevated depressive symptoms. In contrast, students with low social connection reported elevated depression. And then in our model that controlled for social connection, school connection was significantly associated with student depressive symptoms. And then this graph is interesting. So here again, we are looking at the association between elevated anxiety and school and social connection. The striking piece here is that regardless of social connection, having a higher degree of school connection is associated with lower anxiety. Yeah, I'll be happy to talk about more of this later, but I'll turn it back over to Jen to talk about implications.
Thanks, Keisha. Some of the implications that we've been discussing that we're looking forward to talking more about today are the idea that we've been talking a lot about learning loss and concern about loss of academic skills, but our research team has been really interested in the idea of connections lost and the possibility that students seem to have lost their sense of connectedness to school in some cases, and how do we rebuild that sense of connection purposefully and actively. And there are, I think, a number of different contexts to think about rebuilding connection this year and going forward. So first, what can we learn about what happened here in terms of future epidemics? And as COVID continues, if there are other periods of time when schools are closed down or when school buildings are closed and when learning is remote. And second, even now when classrooms are quarantined or when students need to go home for some period of time, how do we, again, purposefully and actively maintain a sense of connection for students when they're not physically present at school? And then third, we're interested in those individual students who are choosing to continue to learn remotely or for various reasons are learning remotely continually and now. And when we think about individual students and the unique reasons why they might be learning remotely instead of being in person at school, what can we do to foster a sense of connectedness for them too? So I'm going to turn it over now to Professor John Zaff to moderate the discussion. And Professor Zaff is the director of Ceres Institute, which is hosting this webinar. We'll look forward to discussing further with you.
Thanks so much, Jen and Keisha, for that great presentation. I think it's, as the presentation showed, and as Marissa mentioned at the beginning, this is the idea of connectedness and just the interpersonal that became such an amplified issue during the pandemic. And so I'm excited to talk with all of our panelists today, and appreciated the reference to the Surgeon General's report that as many of you may have seen, that just yesterday released a very rare advisory on what's being considered a pending crisis around mental health issues, and with the Surgeon General who literally wrote a book about the impacts of loneliness around the ideas of isolation and the need for connectedness. So I'm really excited within the context of this issue to have this discussion with everybody. So with that, I'd love to introduce two more of our panelists, Ellie Castine and Stephanie Malia Kraus. If I could ask them to come on screen. Thank you. Wonderful. I'm going to allow them each to talk about their own backgrounds and really introduce themselves instead of me doing that, because I think in talking about who they are and what they're doing really, I think, speaks to this issue. So I think it will really be powerful for them to just talk about who they are. I'd start with Ellie, if you want to just introduce yourself and just reflect, sort of your initial reflections on what you're seeing in these findings.
Sure. Thank you, John. Thank you, Jen and Keisha. It's great to be here with my alma mater, Wheelock, as was mentioned. I am a child and adolescent psychologist at Cambridge Health Alliance. So for those of you who are not local to Massachusetts, we are one of the very last public hospital systems in the entire state. And so the populations that we serve often have been turned away from other places and tend to have numerous psychosocial stressors. And so I spend my time, I have a relatively small caseload in that many of the teenagers that I work with are multi-system involved. So that can mean all kinds of things, but often they are involved with the court system, they're involved with the Department of Children and Family. Many are immigrants whose families may not speak English, so we use interpreter services all the time. They are very high risk, and I mean that in the sense of risk immersed. And so they're at high risk for negative outcomes, whether that is, dropping out of school, teen pregnancy, homelessness, et cetera, or they're high risk because of, suicide risk. And many of my patients have been hospitalized even within the last year. So that's a part of my role. And then I'm also I serve as a consultant to Cambridge Public Schools. So I do safety and psychiatric assessments when a student is presenting with concerns that are really interfering with their ability to engage academically and socially. And then finally, I am the co-principal investigator on a research grant through the National Institute of Mental Health called Alacrity, where we are looking at screening and early intervention for youth in our school-based health centers with the goal of exploring if this helps to decrease racial, ethnic, and linguistic disparities in terms of access to treatment. So I have my hand at sort of in all different pieces of the adolescent mental health world. And, to keep it brief, I think one of the things is that it was trending not in a good way pre-pandemic, and the pandemic has simply exacerbated that. So on the one hand, these issues are what we've been struggling in the field, we've been struggling with in the field for a very long time. But it's nice to see things being recognized that this is a tremendous problem. The downstream implications, if we don't address it now, are significant. And so I look forward to talking more about that.
No, thank you for that wonderful introduction and also just these initial reflections, which I know we're going to dig into some of this, really important, which I know, Stephanie, these same issues are so near and dear to the work you've been doing for so long. So we'd love to, one, just introduce yourself, but also then, your also initial reflections.
Yeah, thanks, John. And I'm glad to be in this conversation with you and Ellie and to hear about the research. So Stephanie Malia Kraus, I am calling in from my basement in St. Louis, as is how we do Zoom rooms these days. And really thrilled to be a senior fellow with Ceres. I also own a consulting shop, First Quarter Strategies, and really the focus of all of the work that I do with partners in the field at the national, state, and local level is thinking about child and youth well-being, particularly in the context of family and community, and readiness. What exactly do they need to be ready for a world that is changing so much? For those of you who are on the front lines who are joining the call, my background is as a teacher and a school leader and a social worker. I actually left the classroom to go to social work school because there were such profound social and economic and environmental issues that I wasn't equipped to handle or address or even begin to think about as a classroom teacher. And so this has really been long time work for me. I think in my relationships around the country with school districts and organizations and counselors and others, issues of mental health, as Ellie said, have been something we've been concerned with for some time. And the pandemic was really an accelerant, as was the uptick in racial violence and the economic crises that all overlapped with each other. Beyond that, a conversation, John, that you and I have had is that if you look at our older teens, our high school near graduates or kids who recently graduated, their entire lifespan has been defined by the major crises of our lifetimes. These are kids who were born immediately after 9/11. They started kindergarten right after the Great Recession, and now they're launching or trying to in the middle of a pandemic. And so if you think about young people underneath, that's an entire lifetime of instability and disruption. I really appreciate the one thing I'll just share before we go into questions is that the research and the Surgeon General's warning both connect to what you mentioned, John, this role of social connectivity. And I think that in education, we talk about social emotional learning, in counseling and social work, we talk about mental health, but really thinking about social health and connectedness as such a crucial priority, and that what happens in its absence, and that places like schools do so much more than provide an education. And I think we're seeing the ramifications of that in a really big way in this moment.
Thank you for those reflections. And, we'd love to bring everybody in. So Jen and Keisha as well, to maybe we start with this point, I think, Ellie and Stephanie, that you both were starting to touch on, which is a lot of the issues that we're seeing now around mental health is not necessarily, they're not new. And arguably it's an amplification. It may be a broadening of who's impacted by traumatic experiences, but these aren't necessarily new experiences. So we'd love just people's reflections overall about, what you were seeing pre-pandemic and now into the pandemic, differences, but also similarities, to really dig into that a little bit more. I love your reflections. I'll open up to anybody who would like to start with that.
So I can extend on what I just said and then pull back just really quickly to say that because of this sort of lifetime defined by crises, big global ones, in addition to what any generation of kids will experience. I see it in the chat, what's happening at the family level, at the cultural level, at the community level. You have a new generation of young people where instability and insecurity are really defining all of their experiences and view on the world and the orientation. So there's a deep desire for stability and security wherever that can be found. I do think there are some things that are new. And that's that sort of pressure, what happens in the pressure cooker situation, where, for some young people, if they were predisposed to some mental health issues, those can be happening earlier or with more intensity. And not only is there the learning loss and the connections lost, which Keisha and Jen, I love that. But developmental delays, missed milestones. And so I know a number of, for instance, high school teachers who are not trained in adolescent development, and they've got young freshmen and sophomores who the last time they were in school, they were in just beginning middle school, or middle school teachers who the last time those kids were in school were fourth graders. And so there's a disconnect, which we haven't ever seen before at a really large scale, between where kids are developmentally and experientially, and then their brains and bodies and biology.
Yeah, maybe, love maybe Ellie, and then would love Jen and Keisha as well to reflect on this. But Ellie, knowing you're in schools currently and working in a clinical setting there, which you spoke to, but I think, building off what Stephanie is saying about these sort of missed opportunities to interact in school, to sort of live a normal, what would be considered just a normal life as a kid. What are you seeing specifically, in the schools that that would sort of raise some concern for you compared to what you may have seen prior to the pandemic?
Yeah, so I think, what you alluded to, John, is that the intensity of the behaviors is really notable. Stephanie mentioned this as well. I think that in some ways the baseline of distress has increased. Everyone in some way felt a shift related to the pandemic and the stress that's attached to that. And so I think for those kids who are, really hurting, the ante has been upped in the ways that they're trying to communicate that to us. So I think, we've seen the externalizing behaviors at school have increased and are getting younger and younger. And again, I think that's kids' way of communicating how they're feeling. And so what I mean by that is we've seen more fights in schools, we've seen more weapons, we've seen, and again, starting younger and younger. And this is not unique to the school systems I'm working in with my patients or with Cambridge Public Schools. I'm hearing it across the board. I think also a really important piece is that for many kids, home isn't always a safe and supportive space. And so in particular, thinking about families where there's been significant intergenerational trauma or LGBTQ youth who are not affirmed, or maybe they're not even out at home, it has overloaded the family systems. And I think that with having limited space, when everyone was stuck in the same house, there's, if there's shared traumatic experiences, they're triggering one another, and that's resulted in more kids in our system. So I think for some kids being back at school, it's been a relief to have that time away from home during the day. And so I think it's really important to be factoring that in as well.
I'll add a little bit about the Children's Mental Health Service System, which prior to the pandemic, we know was not adequately resourced to serve children and adolescents. Studies show that about 2/3 of children and adolescents with a diagnosable mental disorder were not able to access mental health services before the pandemic. And it was much harder. It has been much harder and continues to be much harder during the pandemic. And I think the Globe has done a nice job of covering some stories about the lack of accessibility of mental health services, particularly for communities of color around Boston that have been most impacted by the pandemic too. So I think that as we're thinking about children's mental health and making sure that they have access to the resources that they need, we know that most youth who do access mental health services receive them in their school. So what happens when those school services become remote, and how do we make sure that children continue to be able to be connected to the services that they need?
And I think quickly to add to that, there's just this ginormous gridlock right now, right? So we don't have enough inpatient beds. At any given moment, there are close to 100 kids in the state of Massachusetts sitting in emergency rooms waiting for days to get an inpatient bed. But then those kids on the inpatient units are stuck there because there's an inability to access outpatient services or residential treatment or a DCF placement. And so everything is, my caseload's full. I know every therapist out there is constantly feeling like, can I take an additional kid? Because we're all feeling the squeeze on the system. And so I just think that it was always, there was always a higher demand for mental health services than could be provided. But I think the pandemic has shown light on those cracks in the system and really widened them. And that's why I think research like, Jen and Keisha's is so important, to be thinking outside the box. How else can we be supporting and promoting mental health? Thinking about factors like school connectedness, to, try to be creative in our solutions, I guess, in the sense that I wish there would be a day where there would be a therapist for every single kid and adult out there, but that's unlikely. So we're going to need to shift and get creative in how we're thinking about meeting the needs.
Yeah, and we'd love, these are just such important comments about the infrastructure that is available or not available for that matter. And love reflections on sort of movement that we're seeing in Massachusetts. So there's legislation in the state Senate that's been advanced that would, the proposal would be to provide residents with an annual mental health check, and then remove barriers for children with complex mental health needs to receive care, and really dedicate real dollars to behavioral health professionals. What do you hope happens with that? The bill, like, are there things that you hope that policymakers will consider as this legislation continues to move through the process?
I actually had something to say about the other question, if that's okay, and then like I'll open up the floor for the
Please, yeah,
legislation.
no, please jump in.
So I don't work in schools, but I am a clinical research assistant at Bradley Hospital. It's a pediatric mental health hospital in Rhode Island. And I will say I joined after the pandemic started, so in June. So I've been here for 6 months, but it's interesting. I do follow-up assessments for our clients, and so some of them have been in our studies before the pandemic started, right? As well as, or they've joined since then. And it's interesting to hear their stories because for some kids, like actually being remote was so much better for their social anxiety, right? It's like you don't have to sit there and kind of like feel forced and people are staring at you to do things. However, for some other kids, it actually worsened things for them because they feel like everyone could look at them on the screen. And then in turn, yeah, so this is very interesting. So they would either turn off the screen or like their camera, and who knows how teachers felt about that. But then also sometimes they would just like not attend class, which is harmful in another way for academic standing because now they're also behind in that aspect. And then we have younger kids who some had separation anxiety before, so now it's like, cool, I get to be with my parents all day, it's fine. Other kids are like, this is kind of like the context that they grew up in. So now that they heard that they wouldn't be around their parents all day since school was going back in person, they're like, why is everybody saying this is a problem that I want to be with my family? Like, doesn't everybody want to be with their families? Like things like that. It's just very interesting. So yeah, I just wanted to put in my 2 cents about that.
I'm glad you did. That was, I think really important points to make. And again, raise these questions of like, these sort of small benefits of like you get to actually be with your family, and that can have huge, reap huge benefits, again, balanced with, I think, Ellie, what you mentioned, which is, for some young people, school can be a safe haven. And so it's recognizing that we need to understand the individual child when we're thinking about their health and well-being. Would also like to think about the getting back to this idea of infrastructure and capacity, which is around the and I reflect on, I know there was a Q&A with Stephanie with your question about issues of capacity, knowing that there's a teacher shortage. And so when we think about, Stephanie, you reflect on the fact that, teachers aren't necessarily equipped with the knowledge and skills to be able to, about adolescent development and adolescent psychological well-being, to really be able to be there for their students. So, would love to pick up on that point and maybe see if you have more thoughts on this idea of capacity and infrastructure within schools.
So John, I don't know if you saw it booted me off the webinar. So I'm guessing that you're talking to me. So I think we did a little behind the curtain about this question. So I heard the end. I think this is for me. Is it? And can you hear me?
Yes.
Okay.
So
great.
You're all good.
Oh man, you all disappeared for a minute, like Marissa's slides. So infrastructure and capacity. I mean, I think I want to speak to one thing that that Keisha mentioned and then make that as a transition. So for young people who have been hardest hit and most held back by the pandemic because they already were living in really hard, tough circumstances, including youth who are homeless, youth who experience foster care, youth who are newcomers, undocumented, who are children of teen parents, all kinds of very vulnerable situations. The pandemic did this interesting thing when we think about infrastructure and systems, which things that advocates for those kids have long been asking for: universal free food, reducing stigma in other ways, sort of compassionate care. What do you need? Food banks set up at school. Suddenly, these barriers that from a policy perspective we thought were impenetrable were removed. Universal, campaigns for universal broadband, digital devices to every kid, regardless of what was going on. I remember running a school and you were afraid to give devices to kids, and heaven forbid you send that device home in the kid's backpack. And so I think one thing is there's a flip to the pandemic of how do we actively reflect on what we thought was unmovable, or that we couldn't provide to students who were most vulnerable, that suddenly when lots of kids were in vulnerable situations became possible, and what can we learn from that? The other piece is addressing these legitimate capacity issues. I saw Stephanie Wu put a question about teacher shortage. So we are on the cusp of a hemorrhage of teachers, social workers, counselors, nurses, all sorts of folks who are working with kids, burning out, leaving, taking a break, switching careers. And that's going to have a real impact. And so we need genuine, fast policy solutions to address both the pipeline, who is training to become the next generation of counselors, educators, et cetera, and how are we supporting the well-being and retention of those who are there? And then how are we bringing in new? So there's like the physical body issue. I also think we can see governors and mayors stand up, state and local children's cabinets, blue ribbon task forces, advisories, the Surgeon General, Secretary Cardona at the federal level can appoint SARs who are focused on mental health and grief and loss and trauma, and really having those folks present in every decision. I'll point out that there are states like Virginia and North Dakota that are making huge strides to become trauma-informed states, because every single kid and every single family has experienced traumas, plural. And then you have compounded ones for, again, kids who were struggling before. So we need this healing agenda more broadly, and then thinking about what the long-term infrastructure is. To Ellie's point, we have these compounding issues. We have an aging health population at one end of the continuum, and now we've got this group of kids, an entire generation with real mental health and healthcare. This is our long COVID recovery. So we've got to think about this long haul in a different way than long haul physical COVID, long haul social, emotional health, mental health for these kids.
And to those points, Ellie, I would love your thought, because you talked about many of the young people you are working with are multi-agency kids. These are receiving services or are engaged with multiple agencies within Massachusetts. And to this point about this capacity issue, or just the issues that the young people are facing, what are you seeing in the both in what's able to be provided to these young people, what issues they're facing that are different, but also then what are you seeing those gaps in services that need to be filled?
Sure. So, I think one of the things that was fascinating was all of a sudden we had never done telehealth, and there was this rapid shift to doing everything virtually in terms of the care we were providing back in March 2020. And it was such a mixed bag, in the sense that on the one hand, we had less no-shows and missed appointments for some families than ever before. They were not anymore having to take multiple buses and the T and these, it was taking them an hour to commute to the appointment. So that was awesome. At the same time, I had kids that didn't have internet at home, who I never, to this day, don't know what they look like, right? Because it was all just by phone with an interpreter. So there's an interpreter on the phone as well. Like, think about how complicated that is when you can't even see someone and be able to really hold them in mind. Similarly, there's also the issue of, even sometimes when families do have internet, it's, a child's trying to share something really personal with you and it's going in and out, and you're like, can you repeat that again? You froze, which is also brutal, not to mention having a private space. I have many kids who take their calls from the bathroom, because that's the only place in their house where they're able to really shut the door. And then even still, obviously someone has to use the bathroom and they need to leave, and we pause for a minute, we make use of the chat. And so it's having to be very creative in that sense and flexible in the way you do things. It's been really nice to be back in the office a few days a week because there are some kids that it just didn't transfer in the same way. But, you know, I think, like I said before, the systems are just taxed. I think there's also total variability. There's a lot of people that still are only doing telehealth. And I think there are some presentations that really require being in person. I can think of a kid that I had last year, a teenager who had developed some symptoms of psychosis. He being on telehealth was too much, thinking about who could be tuning in to the virtual capacity. Was I definitely in a room privately, even if I show, you know, the doubt and suspicion and paranoia that came with that, it was totally unproductive. So I think there's that piece of things. There are a lot of in-home teams that previously, so they do a lot of great family work when they're in the home, but those transition to virtual, and that's, again, simply not the same. So I think, you know, also just thinking about the kind of policy question you'd asked and the mental health checkups and things like that, I think it's phenomenal. And I think the other really key thing is taking a prevention lens. The kids that end up with significant issues as preteens and adolescents, there were warning signs typically, you know, barring some significant stressor or traumatic event. Often these are the kids that maybe in elementary school were struggling to sit in their seat, or in middle school they started to run with a questionable peer crowd, or, you know, we know a lot about things to look for. And so trying to get in and offer some support, such as, you know, the modules that Dr. Green mentioned that were developed, helping kids before they meet criteria for a full-blown psychiatric disorder is going to be the way to mitigate further burdening of the system. And there are so many amazing interventions that can be done early on. And I think we don't capitalize enough on that. And so again, when kids are landing on my caseload at this point, they're at the total opposite end.
Sure. And you know, your point also then about this, you know, this checkup, you know, I think one is, yeah, how phenomenal would that be that it becomes an you know, a very normalized experience that everybody has a mental health checkup, and that is something we should all be doing. And to your point about the prevention side of that, how powerful that could be, both from just the benefit of the individual and the community, but also clearly an economic savings for the state. And Jen, I was wondering your reflections here. You mentioned you and Keisha, you know, had this, you know, great term of connection loss versus learning loss. And, you know, we think about, you know, our public health friends would consider these issues to be things, you know, like a social determinant of health. And that we need to, if we're thinking about a checkup of somebody, that this is something we should be checking into as well. And, you know, would love your reflections on sort of that solution side. So if we're seeing this connection loss, what are some ideas about how do we help to resolve those issues?
Or I'll start, and Keisha, feel free to jump in as well. I think the first thing that I've been talking to schools about when I'm meeting with schools about this topic is about prioritizing connections, and prioritizing connections in the same way that they're trying to prioritize, again, this the idea of learning loss and regaining academic skills, trying to put as much or more energy into the idea of regaining connections, both between teachers and students and among students with their peers. So really thinking about how they can be thinking about making sure that they're putting in time to build connection, and making sure that they're spending time in things like advisory periods or other opportunities during the school day, where we know that a lot of connection tends to happen, and not minimizing that time in efforts to regain academic time that has been lost in the past. And then I think, second, to your point about trying to do some assessment, a lot of us go into schools and measure health risk behaviors and measure mental health risk, but they're really good assessments also measuring school connection, measuring positive youth development, and measuring how students are doing in terms of their feeling excited about school and engaged in the school environment. So partnering our measures of risk with also measures of strength, so that we can understand which students are doing well, and trying to deeply understand what is facilitating that wellness for students who are feeling really engaged and connected. What keeps students coming to school? So that can be a really important question, is what was meaningful that brought you here today? What was meaningful that helped you to feel engaged today? And then just a third point that that we need to be thinking about this across childhood. So there is a really strong emphasis on social emotional development and learning in early childhood and elementary levels. And some of that dissipates as children get older and move into adolescence. And there's not as much that we know about social emotional learning and programs in adolescence as there is for young children. But that's that needs to change. Our adolescents need to feel as connected and need the same kind of social and emotional support as young children do. And that starts in our teacher preparation programs. We need to be thinking about how we're preparing our teachers to support children broadly and across their childhood and adolescence. And Keisha, I don't know if you want to add anything to that.
Yeah, that was great, Jen. I think for me, I know part of school connectedness is kind of used interchangeably with like school belonging. And I think one of the questions from our school connectedness questionnaire really stood out to me is like, I feel like I belong at this school, which I think can be, of course, thought of in different ways. But I think this pandemic and kids especially have been seeing how disproportionately this pandemic has impacted certain groups of kids, including like race and ethnic identities. And I feel like part of the I belong at this school is seeing that your school cares for your identity and supports that and isn't trying to like kind of like assimilate everyone into like one culture. You know what I mean? So I feel like there's also different ways and not just like classroom discussions. And yes, like having like more group time and other things like that is very important. But I think on like the school culture level, I think that is also very important for schools to, I guess, broadcast that they support these kids and their identities and that they too are welcome.
And I would love, John, if it's okay to build off of what Jen and Keisha are saying. And one thing is to just like name for folks who signed up for this webinar that, you know, this was a webinar titled purposefully, like, how are the tweens and teens doing? Not, oh my God, that's a mental health crisis, but oh my God, it's a mental health crisis. And also, how are the tweens and teens doing? And there's this tension that we've got to negotiate on a daily basis, which is in this moment, it's not about surviving to thriving. It's a duality of how am I surviving and thriving kind of at once? How are we attending to both things? And so we do know from a youth development perspective, and what Keisha was just saying, increasingly have good research from folks like John Powell and others on belonging, the power of social connection, the power of relationships, the power of belonging, identity, meaning, cultural connections, these pieces. And we also know that this confluence of things that are happening right now are bringing up situations and circumstances that Ellie is seeing, you know, and I threw an article into the chat about our own experience in my household, and my husband and I met in social work school with my little tween having a mental health circumstance that ended up being related to a physical infection that triggered mental health. And even as a social worker, I was not trained for that. And we didn't know what to do. And it took learning more about our family history and then negotiating physical care and mental care at the same time. He is supported and helped because of the social connectivity and coordination between a team that is there and loves him, and also has a set of new challenges and barriers that he's got to learn to negotiate. And so surviving and thriving are happening in a day or a week, and they sometimes toggle back and forth. Now, this is a kid with immense privilege and with two parents and grandparents and all kinds of resources. And so then if you unpack that, you can think about how much harder it is for kids who don't have those same supports. I would encourage any teachers who are listening in to think about things like getting trained in mental health first aid, upgrading or upskilling your learning around the science of adolescence. We know a lot more than we used to. You know, teens and tweens, their brains develop as much as our little ones. And we didn't know that before, and the impact that can have. So I just wanted to sort of point out that there's a lot of good, rich youth development work that we need to be prioritizing at level with academics, if not above. And there are new mental health challenges, as evidenced by this conversation, that we have to like literally educate themselves. In fact, myself, like even though I work on this, I just bought a new like tome of a book on child and mental health and psychiatric disorders because there are real gaps in my own knowledge around this.
Thank you, just everybody, for those just great insights about just like these are issues, and how do we actually get to a place where we can, ask this question of how are our teens and tweens doing, and be very confident in a more positive answer. And I think that one thing I'll reflect on is my colleague Yasko Kano and I'll really say it's been, and Yasko's real lead on this, have been talking with young people from across the region about their experiences, to really understand with some richness about their lived experience. And one thing that was really powerfully came out of that was, one, the issues of mental health issues that we're talking about here were definitely prevalent, but that they could name an individual adult who they could turn to, but they could not point to a systematic structure that was in place that they could plug into. And so this is a question I see sort of in the Q&A, and others have brought this up, which is, where do I turn to? And if you're lucky enough to have that one adult who can identify what's going on with you, that's great. But more likely than not, that's not going to happen. And so what more systematic structures, or formalized structures, are there to support? And I think that really, so really appreciate all the points you're all bringing up, because I think it really points to this idea of like, we need to build cultures, we need to build relational context, but also need to create real formalized structures that people can plug into.
I don't know if I could say just one more thought
Please,
about
yeah.
that, just to build on what you were saying, because I don't know if everyone can see this, but there are some private chats coming into the panelists here of parents who are talking about struggling with their child or adolescent's mental health and where to go. So first, just want to say that there are several of those chats coming in. So if you're feeling that way, you're certainly not alone. And there are many parents right now who are concerned about their child's mental health and well-being. And so I think some of the ideas that you're raising, John, are really important. And some of the first things that I talk about with parents, and you're curious, Ellie, from your perspective as well, is to look for adults who their children feel connected with, and trying to enlist those adults in helping to connect their child with mental health services. And we know from a research perspective that children are more likely, and adolescents are more likely to connect with mental health services when they're encouraged to go by an adult who they trust, who they feel cares about them. So if parents are not able to make that happen, sometimes enlisting or connecting with another adult who their child feels connected with can be one helpful strategy. And the system is really complicated. So I see in the chat, the health insurance providers don't make it easier. The system is very complicated. There are some resources in the Boston area, like William James Interface, which serves some of the communities around the Boston area. There's a social work network, and maybe John, we could send out a list to people who attend after this webinar of some different resources that can help families to make connections to different providers in the area. And Ellie, being in a service setting, I don't know if you want to add anything to that.
Yeah, no, I fully second everything that you said. The point is really to get them in the door. Sometimes with adolescents as well, it can be as simple as like, just try it out and hopefully you'll get a therapist. I mean, most adolescents I start with, more often than not, it was not their idea to come see me, right? They're like, I don't even know why I'm here, even though there's 100 reasons that are clear to me why someone suggested that they're there, but trying to just join with them and say like, all right, maybe we can together be frustrated with your parent for sending you here. How can we make the most of this time? And what do you want to work on? And so I say that in my hope that there are other providers out there like that. I know that there are some wonderful providers, but I would also say talking to pediatrician can be really helpful. If there is a guidance counselor, adjustment counselor, anyone at school, a teacher. I think also as the adults in kids' lives, we model what's okay. There's still a ton of stigma around mental health, particularly for racial ethnic minorities who, those providers are still extremely underrepresented in the profession. And so I think being able to name that, the patients I work with are always stunned if I reference my own therapy, they're like, what do you mean you have a therapist? And so I think just trying to reinforce that and talk more about it is really important, so that kids, because there's such a perception that going to therapy means there's something wrong with me, that I'm broken, that I need fixing, and making sure that that's dispelled. I always try to frame it as we could all be better versions of ourselves. It doesn't mean that there's anything wrong with you whatsoever. We all have things to work on because nobody's perfect. So even when things are good, some people may appreciate therapy. And so I think that helps take it down a notch. And but nonetheless, it's tricky.
The Surgeon General's announcement flagged that it's not just the response to this moment, but also climate crisis, continued racism, continued economic, political threats, certainly the division we're seeing in our communities. I think the connected step to what Ellie is saying is we have to norm with our kids, whoever your kids are, parent, coach, educator, counselor, whatever kids are in your life, that mental health is going to be a part of the journey. And when it shows up, how do they know what to do and what are they looking for? And in the same way that we think about, I mentioned like looking at our family history, in the same way that we educate ourselves on the history of certain cancers or predispositions to health issues, how are our kids, how are they getting the language to know what things to look for? I'll give you a really quick example. We also have a long history of addiction in our family. And so I started talking with my kids about it as an allergy to alcohol when they were little, because they had friends who had peanut allergies or penicillin allergies. And we're working our way up developmentally to what does it mean? And what does that mean for them? And so I would just, encourage all of us as a collective of educators and counselors and parents and caretakers that another part of that stigma removal is that we have to be explicit and almost exhaustive in the ways in which we're not necessarily looking that there has to be a problem, but saying life is going to be long and complicated. And so we just want to make sure you have the language and knowledge and know-how when and if things should happen. Better to be prepared.
Kind of a final quick point, if I may. I think this is a hard conversation because the landscape is tough to take in right now across the board. It has been a really challenging 2 years for everybody. But, one of the things that keeps me in this work, the reason that I'm here, is that it is profoundly moving to see the way youth are able to heal and remain optimistic and hopeful amidst endless stressors, particularly those where like systemically the odds are stacked against them, so to speak, and to watch them progress. They are just impossibly resilient. So I don't want that to get lost in here, because kids are really able to bounce back, and there's such an opportunity to support them.
I think that's a wonderful actually way to sort of end our time together. And I know we're coming up on 4 o'clock, and I'm so appreciative of everybody's time. One who have attended to hear this, but mostly to, a huge thanks to our panel. And I think, for me, what I take away from this is, again, the need clearly for more intention in our efforts to support our young people, but also that realization, Ellie, I think you beautifully just said, which is that what we know about young people, we know from the science of adolescence, is that in just childhood and human development, that young people are resilient, and that young people have so much strength and potential, and that they will, in fact, achieve in so many ways in their lives with when they have the right supports in place. And so now it's sort of that call to arms, which is now what do we do we being that collective society do to make sure that we have those supports in place, clearly to intervene when there's more of a critical nature, such as sort of a mental health crisis, Ellie, I know as you deal with on a daily basis with your young people, but also how do we on a full school level really support our young people in a way to create those connections so that we know that they can thrive in the way that that we all know that they can. So with that, again, just thank you all so much for your time and amazing insights, and look forward to continued discussions on these important topics.